back to the Health Marketing Collective, where strong leadership meets marketing excellence. I'm your host, Sarah Payne. In today's episode, we're diving deep into the world of market research with an expert who knows how to turn data into actionable insights. After all, understanding your audience is no longer just a strategic advantage, it's a necessity. Yet many marketing leaders struggle with knowing the drivers and needs of their buyers. In today's conversation, we'll uncover some common pitfalls and explore how truly knowing your audience can be the difference between a good campaign and a great one. Our guest is an experienced market research strategist and advisor, Dan Reilly. Dan is currently Managing Director of Insights and Analytics at SRG, where he helps clients gather insights to drive effective business and marketing strategies. His work has spanned multiple industries, including healthcare, with clients such as the Mayo Clinic, Blue Cross Blue Shield, and Fairview Health. It's a pleasure to have you on the show. Welcome, Dan.
Thank you very much. It's a pleasure to be here.
Yeah, likewise. You and I know have worked together on a number of different research projects over the years, so I know you have a lot of great insights to share with our audience. Dan, let's start by talking about what it takes to truly know your audience. What are the key steps that a marketing leader should take to kind of go beyond that surface level insights and really be able to understand what drives their buyers' decisions and their behaviors?
Sure. So one thing that we often hear from leadership is this idea that the target audience that they're looking at is gender-based or age-based or income-based, a lot of those demographics. And this is true, especially in healthcare, where they start to look at comorbidity and they start looking at various conditions and say, this is how the audience is. But what we have found is that there is a direct and positive relationship between what people are and how they think. So there's this idea of demographics, and then there's this idea of psychographics. And psychographics aren't just emotions, but they're attitudes, normative beliefs, and control barriers that people put in themselves to help understand the world around them. And we tell leadership, don't worry just about the demographics, but worry about why people are doing what they're doing. Not the who they are, or even the what they are with the behaviors, but understanding the why, understanding that motivation, and then grouping like people around that using various segmentation techniques can help CEOs and other leaders really start to get to this idea of, oh, I know who this person is. I know them because I see them, I see their gender, I see their ethnicity, I can see their income, I can see their education, but more importantly, I also see what their hopes and dreams are. I also see how important technology is in their lives. I see how important big institutions are. So when we look at large healthcare systems, there's this idea of the big institution and who's attracted to that. Not everybody's attracted to a big institution. There are some that find really positive elements of it and others not so positive. Understanding that can really go a long way in helping leadership really get to the idea of who they should be speaking to.
Yeah, I really appreciate the way that you broke that down, because I think you're right. You know, human beings are incredibly complex. And, you know, we have to be looking deep into those drivers in terms of hopes and dreams and all of those different layers that comprise who we are and how we make decisions in our lives.
Absolutely.
And, you know, one of the other things, Dan, that I'm always fascinated by is there's such a wide range of ways that market research can be leveraged for marketing purposes. And so to that end, let's pretend for a minute that you're not a consultant. You're an in-house marketing leader. And let's play a game of if my business goal was X, I would do Y in terms of market research. Can you give some examples?
Sure. So let's say that my goal is to convert my current customers to a new product. So if I'm going to do that, then what I need to understand is what is the viability of the new product. I need to understand what's the transference from the old product to the new product. And then I need to understand how can I make sure that at each point that they drop off, we're keeping them together. In a situation like that, people often say, well, we should just go out and talk to the customers. And you're right. You talk to the customers, but you're also talking to prospective customers. Because even though the current customer has your product, there are people who are going to be able to onboard with your old product with the idea of getting to the new one. So it's important to understand both. And the other thing to think about too is that when we're looking at how these consumers think about the product, using a research technique that's quantitative in nature, so a survey or looking at consumer data that already exists, will allow you to start to build that stage gate approach where, okay, they've got the product, now is the price acceptable? Now are the features aligned? Now are we making sure that that product moves forward in a positive way so that the conversion rate can happen? And then you can follow that all the way through using a lot of different analytical techniques, regression among others, that will allow you to see that. So that's one. Another example would be, let's say I am a company that wants to build a new product, but I only know from what I've heard from the salespeople. So this idea then becomes, okay, I am now looking at a product idea that I've gotten from salespeople, and they're all telling me it's got to be cheap, it's got to be cheap, it's got to be cheap. I don't build cheap. What I build is high quality products that mean something to the consumer. So how do I include that piece into it? Well, there's a couple of techniques. One's called Kano, the other's called conjoint, that allows you to basically say what attributes are most important to your customer or future customer. And not only that, but which ones add the most value to the price. So a really good example is this: when we go shopping for a car, we often say we want to buy a car based on price. Reality is we rarely buy a car based on price. We buy a car based on many other factors. Price is at best a secondary one. That allows us to be able to say, when we're buying the car, price is there, but what we really have to emphasize is X. And those are just two techniques that allow us to do that. So I think in both of those situations, you're leaning more into quantitative research than qualitative research, because you're really looking at understanding how to maximize your dollars associated with that specific build that you're doing.
Yeah, that's such an important one, because you're right. A lot of the conversation with sales is going to center around price, but the job of marketing is really to help drive value, right?
Absolutely.
And and increase that value and be able to support a premium price. Any other business goals, examples that you think are really important for folks to be thinking about when they think at sort of look at the overall mix of different market research initiatives that they could pursue?
Sure. So one of the things that we often tell people is, how much magnitude of importance are you putting to this? So is this something that I'm a manager and it's just going to go to the director and we're making a decision that way? Or is this a decision that I'm not making, my boss isn't making, my boss's boss isn't making, but the board is making? When we have clients who come to us and say, I have to work with the board and I have to get their approval for this permission, it is almost always going to be quantitative research, because the board looks at that and says, well, that's nice, you had a conversation with them, but what's the number say?
Sure.
Now,
yeah.
Conversely, we've also had clients who have said to us, what I really need to understand is the context into why we would be making this decision. So I have the hard data on it, but what I don't have is the reasons why. I don't have an exploration or an understanding from the customer of how this could benefit them beyond the simple numbers that we have. Well, in that case, we may do qualitative. We may actually sit down and say, we're going to actually go through this process with you so that you can begin to understand how the consumer feels in relationship to the different KPIs for example. So one time I worked with a client and we were bringing them through their patients through an MRI experience. And so at each stage, we had the capability to sit and ask people, how are you feeling? So here's a chart of people's pictures on them. Show us which one best exemplifies you, and then why is that? What is happening in the environment that makes you think that? And in this case, what we saw is that there wasn't a lot of consternation, a lot of negative feelings, until they entered the room. Once they laid down in the MRI machine, they started to calm down a little bit. They started to understand, okay, I now know what's happening. I now can see this, even for people who have gone through it many times. So we were able to say to the client, our client, when they enter the room, don't have them enter a cold room if you can. Don't have them enter a room by themselves. Make sure someone is there with them so that they can feel a sense of connection and be able to understand how that experience is going to actually benefit them, not only physically because of the MRI, but also emotionally because of the context of the relationship with the tech.
Yeah, that's such a great example where it's way more than the numbers, right? And I think that just is a beautiful illustration of how choosing the right design for your research based on the types of insights you really are looking to drive. To your point, it may be in part driven by the audience of who's going to consume those insights and what matters to them. But I think unpacking at the end of the day, is this a complex emotional thing? Then perhaps it needs to be the qualitative element to really dig deeper than just, a survey response. And actually I want to elaborate on that point a little bit in terms of, qualitative versus quantitative. I want to talk about B2B, and I want to talk about reaching clinicians and understanding their specific drivers, because a lot of the change that I see companies trying to drive in healthcare today is about changing or elevating the standard of care. And clinicians are critical, very critical audience to be able to affect that change. Right? If you don't get them on board with implementing new guidelines or having new conversations with their patients, it's just not going to happen. So from your perspective, when it comes to getting those insights from clinicians, when does it make sense to talk to them directly, qualitative, versus having them complete a survey? What have you seen to be effective?
So one of the things that we've always looked at when we first start understanding the role of the clinician in research is this something that is going to be highly specialized, or are we talking with GPs, or are we talking with nurses, or are we talking with PAs? If we're talking with GPs, nurses, or PAs, then there really can be a balance between the two of qualitative or quantitative. The higher and more concentrated the specialty, the greater emphasis is going to be on qualitative research, in part because the GPs, the nurses, and the PAs are the ones that are closest to the patient. So it's easy to understand their interaction with the patient. The further you get away from the patient, it's almost paradoxical. The further I get away from the patient, the greater the impact I have on what that patient is trying to, or what I'm trying to do for that patient. So in this context, it's really about understanding where the role of the patient fits. That's one piece. The other piece to keep in mind is that as we move forward with the research, how much is it going to cost? It's much less expensive to conduct a study with GPs, PAs, and nurses than it ever would be with anesthesiologists, radiologists, surgeons. So there may just be an issue of, I have $10,000. What do? I had a client recently come to me and say, I want to conduct research with anesthesiologists. I have $15,000. What can I do? And I said, well, we may get you 12 interviews, maybe 15 interviews. I need to really have more than that. And I said, well, then you're going to have more money because these folks are very expensive to speak with. So there's a cost element to it as well. And you hate to put it that way, but that's how it can be driven.
And is the cost, not to get too far down into the weeds from a budgeting perspective, but the cost is driven, I'm assuming, by two things. One, there are fewer of them because it's a specialty. There are just going to be, frankly, fewer of them in the country, right? And so the smaller pool that you're driving from, but also their time is at a premium. I mean, everybody is from a clinician standpoint, but maybe dollars you're bringing to the table to compensate them for their time is higher. Is that also driving the cost, or help unpack that a little bit?
Yeah. So part of what we're seeing is that the consumer has to the client has to understand that when you are looking at speaking with clinicians, that there's the time value of money.
Yep.
And the time value of money is strictly enforced the greater the specialty. So
sure. Makes sense.
One of the things that often happens, Sarah, is that clients will come to us and say, I want to speak with a person who's at Cleveland Clinic, or I want to speak with a person who's head of surgery at Dana-Farber. Well, that's great. We'd all like to speak with those people. But the reality is you're not going to get a hold of them, because it's one thing to have a research company call and say, hey, I need to speak to you. It's quite another to have the NIH call and say, hey, and speak with you. They're answering that call long before they get a hold of me, or I can get a hold of them. That's part of the reality of this too, is that who are you speaking to will dictate how accepted the research results are and how accurate you can understand the market. The flip side to that too is that confidentiality is supreme in market research. That is that's a touchstone that is very sacred. And often people want to say, well, I want to speak with the head of Dana-Farber so that I can use their information in my marketing materials. And that's where we have to draw the line as well. So confidentiality is huge. They're going to speak with us on the guarantee of confidentiality. We can't pierce that. And in case of healthcare, we don't even ask if we can pierce it. With consumers, you can say, hey, we're doing this. Can we use your name? Can we contact you again? Healthcare, that's not something that we ever want to encourage, because it's, well, if you're going to do that, then what else are you going to do? And now we start getting into HIPAA, and what does that mean? It's sunshine laws. It opens up a can of worms. So we generally like to keep away from it.
So you're getting into some areas, common things that may crop up, expectations that you're helping to manage with some of your clients that you consult on. What are some of the other common mistakes companies make when they pursue market research projects? What are some of the things that you just want to highlight in terms of things to avoid doing?
Sure. So there's this old adage in market research. It's true in other industries, but it was certainly true in market research. I want it fast, I want it cheap, or I want it good. Pick two. And clients, while it's apocryphal in the way we think about it, it really is true. If you want something quick and inexpensive, then there's not going to be enough time to really analyze the data, so it affects the quality of it. If you want something that's going to be really understood in terms of an insight perspective, and also cheap, then you got to spend a lot of time doing it, because it's going to take a long time to get those people recruited. It's going to take a long time to do the results, because you can't throw an army at it. You throw one person at it. And then, of course, the oldest adage is that I want it cheap and I want it fast. Well, then your opportunity to have that be a quality piece really gets hampered. So we start looking at the idea of time, speed, and quality. So, and that's a common mistake. I think the other common mistake that people fall into is that the insights will answer all of my questions.
Packing too much in, right?
Yeah.
Versus being focused.
Yeah. The insights only answer the questions that you ask. And if you can't share with me what's actually going on in the organization, or if you can't tell me what you're actually trying to do, then I'm going to come back and miss the mark. And there's so many times that clients have said, well, why didn't we ask that question? And the answer is, we did ask that question. You took it out, or we did ask it because we thought you were going to take it out, and we put it in anyway. And aren't we great that we asked that question? So it's just a part about understanding what the limitations are as well as what the advantages are.
Dan, what is one of your favorite research programs that you've led on behalf of a healthcare brand? And you don't have to mention who it is if you're not able to, but can you share an example of something that you were a part of that was rewarding for whatever reason, or really insightful, impactful for that particular company?
Sure. So I did a study for a healthcare organization.
Meaning like health system, or
health system.
Okay,
Health
got
system.
it.
Yeah, I have one health system, and then I have a manufacturer. But we were doing work for a health system, and we were doing work on understanding how parents view celiac disease. And what we did is we found parents who thought their children might be celiac. And they agreed with us, and we walked through the entire process of them going through this diagnosis. And one of the things that we saw that was really interesting is that the physician would say, we've conducted the test and your child has celiacs. Now go talk to the dietitian and we'll see you in 3 months. The parents had a lot of questions about it.
Yeah.
And the physicians often didn't know the answers because they didn't understand the practical aspects of celiacs. Like I could tell you the elements of the blood disorder and if it's inherited or not, I can tell you all that stuff, but I can't tell you what to eat. You got to go to the dietitian for that. The dietitian steps in and says, well, here are the things that Johnny should be eating. Now, you have to increase the number of vegetables that Johnny eats, and you need to make sure you keep away from bread for Johnny. Well, this is all great, but Johnny's 7, and Johnny likes pizza. So what the heck am I going to do? And what we wound up doing was, for a set of people, we said, well, we're going to send some people to the grocery store, and we're going to send other people to a specialized bakery. The specialized bakery is for celiac, so it's all gluten-free. So the parents that went to the grocery store, what they would do is they'd pick up an item, they would look at it, and then put it down. And then they'd pick up another item, and they'd look at the ingredients and put it down. It wasn't until they got to the potato chips that they could actually grab it and said, my son or daughter will eat these. They won't eat anything else in the store, but they'll eat potato chips. When we took them to the bakery, it was quite a different experience. When they would walk in, the parents would come in and they'd be very, very, very worried. And the kids would be very like, this is going to be gross and all of that. And the ones that were the best, we visited 2 or 3, the ones that were the best that said, hey, you like pizza? And Jimmy or Johnny or Janie would say, I love pizza. It's delicious. Here, have a piece of pizza. Can I have that? Oh, yeah, it's fine. Don't worry about it. Well, I don't know. And the parents would say, well, I don't know. And then often the person would grab it, bite it, eat it, and say, I'm your son. I'm your daughter. I get sick too. And this food doesn't make me sick. And then the parents would almost universally start crying. Almost universally. Because it was this sense of relief that we've now got food that my child can eat and that my child isn't going to get sick anymore. And just doing that kind of work and making that, understanding that connection between the food that the parent is providing the child and what the child is eating was hugely important to the client. And what it resulted in is doctors got a heck of a lot more educated on what food to eat. And number 2, there was a one sheet. Go to these bakeries. They have the food your kid needs. Now, go see the nutritionist and the dietitian and all of that, but go do that and go do that now. Don't do it tomorrow. Do it now, because it's going to answer all of your questions and it's going to make you feel alleviated, because we know how finicky kids are and in terms of eating. So that was one that was related to a health system. The one that was related to a manufacturer is we were working on a new way to think about vaccines, a new delivery system. And one of the things that we came out with was, how do we get people to understand that this vaccine isn't going to be harmful? It's actually going to benefit the average consumer. So when we're developing this vaccine, and this is during COVID, so part of it's the COVID vaccine.
Sure.
When we're developing it, one of the things that we heard was there was a lot of mistrust. And we thought, well, these are the anti-vaxxers, and these are people who are fermenting this distrust for their own personal agenda. So we conducted some research and said, who's likely to get the vaccine? It was a really simple question. We put out nationwide. And what we saw that the group that was the least likely to get vaccinated were African-American men. And we said, why? And they said, Tuskegee Institute. There is a fundamental distrust among African-American men and women, but really men, about vaccines in America and how it's a government conspiracy. And these aren't folks that had any other element of conspiratorial perspective in their thought process, because we asked them, how much do you agree or disagree that the JFK assassination was conspiracy?
Sure.
How much do you agree or disagree that fluoride can cause harm to children? in fluoridated water. So these old ideas, we brought them forward, and it was universally like, no, none of that's true. No, that's true. But oh yeah, vaccines are going to kill me. I don't trust vaccines. So part of what we had to do is say, okay, who can we image in this advertising that would allow them to understand that even at the pinnacle of health, you still need this. At the pinnacle of distrust, you still need this. And one of the groups that we spoke with were African-American athletes. We went to NBA, NFL, and they were wonderful. They would talk about COVID specifically, but they would say, yeah, we'll talk about vaccines. We'll talk about getting vaccines to folks. And we saw that as a result of that, the uptick in vaccinations among African-Americans, especially men, increased about 10%, which was a really cool thing to see. But you don't think about the mistrust of, well, it's all just the hype from the anti-vaxxers and all that. No, in this case, it was a legitimate concern. And when they said Tuskegee Institute, I was old enough to understand what that meant. My younger colleagues kind of looked at me and said, what's that? I'm like, well, okay. It's time to crack out the books and get you learned on this, because you really need to know this. You really should know this. So it was a great opportunity for not only them to learn, but for us to understand that just because you think something's happening, you need to take a deeper look, and you need to be open to what it says, because it may challenge you, and certainly challenged our client. Well, that's just not true. We're not racist. No one's saying you are. You just have to understand this is the perspective.
Right. So, some deep-seated beliefs that are out there, right, that could impact the effectiveness of the adoption of whatever it is that you're rolling out, which is, I think both of those examples are really great, because I think it speaks to the importance of not only understanding the audience, but then what's going to be effective in terms of rolling this out from a marketing perspective to support effective adoption. Right. Sure. So in the case of the health system, I love, I felt thinking about this from a marketing perspective, I love this notion of really bringing more education to the bedside. Right. Yeah. And convincing, using the insights to help convince clinicians that this needs to be part of that care experience and that bedside experience with these families who are being, diagnosed with celiac disease. Yep. Sending them away with a diagnosis is going to be a very negative experience for them. You need to, in order to be a partner and a trusted partner that they're going to come back to again and again, and to, build that relationship with the patient, a family, and what have you, is to deliver more of that educational component. I love that. And then the other one highlights, the importance of representation, right? Who we're showing in imagery, who we are bringing forward to talk about the importance of these things in our campaigns is really important as we think about effective adoption, particularly in areas where there might be lower adoption for whatever reason, and obviously makes complete sense in that example that you shared. I think we have to talk about AI, Dan. I mean, we can't not talk about AI. I am interested in your thoughts on how AI has improved the ability for companies to gather helpful insights. And I'm not necessarily predicting that AI is going to replace the need for formal market research, nor am I suggesting that anyone should just go out on their own, right? For all of the obvious reasons you've already laid out here today, you really want to bring in a real expert on this. I'm just curious what your perspective is on whether AI can be helpful as kind of a first-line collaborator for gathering insights. What can it do well and not do well? Anything you've been sort of flabbergasted by that you have seen, where AI has just gotten something horribly wrong? What are your perspectives?
So when we look at AI, the great thing about it for market research is you can give it a large data set, and it can cull down for you what you really need to know. So
summarize insights, analysis.
Yep. So we have a product that we call the virtual SME, virtual subject matter expert. And what we do is we take all of our clients' data, their PDFs, their reports, and we put it into our proprietary system that uses AI to start to output answers to questions that we have. So we may have a client who is looking to better to develop the next generation of prosthetic. And they may have all these reports saying the number of people that have prosthetics and all of the interviews that we do. And we may ask, what are the three most important things when thinking about building prosthetics? And it'll say, these are the three most important things. Great. Now, what if I'm building a prosthetic and it doesn't fit right? What are my options? So I'm answering this. And it'll say, here are your four options that you have to do. The great thing about it is that it allows us to then start to say, okay, we can really start to hypothesize building really based on this, and then go to the qualitative to explore the hypotheses, to validate those or to formulate them better, and then go to the quantitative to validate. So that's one thing that's really good about it. An area that's really challenging for AI is that it makes the assumption based on the information you give it.
Correct.
So
yes.
If you ask it a bad question, it's going to give you a bad answer. And one of the things I've had people say, well, I often want to just be more informal with it. Well, you can be informal with it. You can say, how you doing today? And it'll say, fine. That means nothing. So why are you asking it? And the other thing is that when people ask very complex questions and they say, well, I'm going to rephrase it a different way, and they get the identical answer, it means that the AI tool, whatever tool they're using, has tapped out the limit of it. So it's always helpful to understand that everything with AI is trial and error. And it's more error than trial. But once you get it right, it's a very helpful tool to summarize, very helpful tool to bring down. But what it doesn't do is it doesn't think for you.
Absolutely. Yeah. And you're right. It's all about the information that you give to it and the questions that you ask. But hasn't market research always been that way, Dan? I mean, the design of the question is so critically important in market research that this is probably not surprising to you, right?
No. And then we always say, I'm only as good as the questions that you allow me to ask. So if I'm not asking the right questions, I'm not going to get the right answers. And when we often see clients come back and say, fortunately, this not happened to me for many, many, many years, but clients will say, this doesn't make sense. This doesn't work for me. It doesn't meet my expectations of what happened. 9 out of 10 times, it's because we didn't ask the questions that we knew they wanted us to better understand. We just went out and said, oh, no, we know best. We're going to go do it this way. And the results aren't always as you hope. Sometimes they work. Sometimes they don't.
Yeah, absolutely. Well, Dan, let's switch gears here for a quick fire segment before we wrap up.
Sure.
What is one of the coolest facts or surprising insights that you've uncovered through research?
I would say the coolest fact that I have uncovered is that when we think about how physicians deal with patients, that one of the last things they consider is how the patient thinks. They're always focused on how the patient physically feels. They rarely focus on thinking. So they always miss anxiety. They always miss consternation. They always miss silence. They always think, this is just a great experience. They didn't say anything. They were really focused on what I was saying. Like, no, they were staring at you because they were terrified. And they didn't say anything because they're super anxious. And you need to pick up on that. And you need to have techniques that allow you to do that. That's one of the coolest things in the healthcare that we saw. And they explain it to doctors. They're like, oh yeah. Well, yeah, there was that one. Oh my goodness, this happens all the time, doesn't it? Yeah.
Interesting. I wonder if we'll see that change over time, because obviously the conversation around anxiety and mental health has definitely exploded as a result of COVID. So perhaps we'll see that shift over time. If you could give one piece of advice to chief marketing officers about market research, what would it be?
That there isn't just one way to skin that cat. And many times I've said to CMOs, if you're looking at understanding what your market is, you have to do two things. You have to explore for understanding and then validate for prioritization. If you're just going to talk with your customers, you're never going to be able to prioritize. If you just validate and prioritize, you don't have any idea what you're validating because you didn't go to the market to find out what the hypotheses were. So it's always do both. And it doesn't have to be quantitative and qualitative research that does it. You can do a search for on AI about, hey, how do these customers think? Use that as a basis and then figure out, here's what I know and here's what I don't. What I don't know, do I not know it enough Do I know it enough where I can validate it, or do I not know it at all and need to go out and explore it? Those are the kinds of things that need to be, that CMOs really need to get, is do both, explore and validate. Don't just do one.
What's a market research trend that you think will dominate here in the next year or so?
I can tell you which one I don't think will, for sure,
Okay.
and that's AI. I think AI has seen it run its course in market research. We were all very excited and scared, a lot of consternation about how it's going to replace my job and everything else. Well, now that it's settled, people are starting to see, oh, it really doesn't do all this. It only does these things. And the shine is starting to wear off. We're not seeing AI in everything anymore. We're now just seeing it in certain names and certain institutions and certain products. So I think one thing that's not going to happen is AI. I think an area that's going to start to grow even more is experiential marketing. So there's a lot of emphasis now on satisfaction and all of those performance indicators, but now we're starting to see, well, no, it's the experience that drives it. And it's always been there, but now we're starting to see, and this goes beyond CX. So I don't mean the customer experience in terms of I went here, I went here, I went here. There's certainly a value in that. But what we're really talking about is, how does that make you feel? How does that add to your life? Much more about the motivations, which at the beginning of the show, I said that it has to be below at the basis to understand behaviors and understand performance. So I think those are the two, or that's the one big area. Experiential research is going to become even more important as we move forward.
Great. Last question.
Yeah.
What's one question every marketer should ask their audience?
What's it going to take to get you to buy my product? That's really it. And it's not, note I didn't say, what are the benefits? Note I didn't say, why won't you buy my product? It's, what's it going to take for you to buy my product? Now, we obviously put it in much more elegant terms.
Right, of course.
At the end, it's, what's it going to take for you to buy my product? That's the ultimate question that any marketer should be asking.
Love it. Well, Dan, this was a real pleasure. I know I learned a lot today. Thank you for being here. How can listeners get in touch with you?
So if listeners want to get a hold of me, there's two ways they can do that. They can send me an email to DReilly, DREILLY, at srg.com, or they can visit our website, www.srg.com, and send us some comments there. But yeah, if anybody has any questions or follow-up, we're more than happy to answer them.
Yeah, Dan is a wealth of information, so certainly reach out to him and he will get your market research initiatives off on the right track. Well, that's it for today's episode. If you enjoyed the conversation today, do us a favor and subscribe wherever you get your podcasts. Thanks for being part of the Health Marketing Collective, where strong leadership meets marketing excellence, because the future of healthcare depends on it. We'll see you next time.